Let's talk about few facts related to uterine fibroids. If you are facing that situation, if your fibroids are asymptomatic and they are not creating any kind of problem, so you don't need any kind of treatment. If you are having severe pain with heavy bleeding in your menstrual cycle, besides that you have back pain and you have constipation problem and it's affecting your lifestyle, then definitely you need treatment. The bitter truth of fibroids, even if you get any treatment done, it can grow and it can shrink as well. These are the non-cancerous growth of muscles or tissues. If those tissues are not creating any kind of problem, then it's fine. But if you are in your adulthood and if you are planning your pregnancy, at that time it can create some kind of infertility issues and you need to have treatment for that. If fibroids are in smaller to medium size, you don't need any surgical treatment for removing fibroids. You can take medications to shrink fibroids. So let's talk about those medications. My first recommendation to shrink the fibroids is wait and watch game, because sometimes it has been seen that fibroids can shrink, so you don't need to do any kind of medications. But yes, if fibroid size are getting bigger, at that time you definitely need medication. If you have already babies and after that you have found that you have uterine fibroid condition, so most of the time it has been seen that after pregnancy they shrink automatically. Many researchers have found that most of the women who after their pregnancy they got smaller in size, so you can wait for that as well. If I talk about most common medication, the first medication which is pretty common is Mifepristone. This is a medicine which is usually given to control your hormone like estrogen and progesterone, because fibroids growths are related to progesterone and estrogen hormone. If your body has more estrogen and more progesterone, it definitely encourage fibroids to grow more. So this medicine helps to shrink the fibroids because it controls estrogen and progesterone hormone. The second medication name is Ulipristal, and it is usually recommended by your health advisor if you have not reached your menopause state. It's basically a birth control medicine, and it is usually recommended when you are about to have your fibroid surgery, and it helps to shrink the fibroid size. So before planning the surgery, first your health advisor would recommend to shrink the size of fibroids, and then they will do surgical treatment. Your health advisor can suggest you Leuprolide. It's a medicine that is also used in IVF treatment to stimulate the ovaries, and in fibroid situation this medicine is generally given to control the menstrual pain and menstrual bleeding. So actually it does not contribute directly to shrink the size of fibroid, but it helps to control the bleeding and menstrual pain. So sometimes it may be possible that because of that medicine the fibroid size can be shrink in future. If you are done with the family planning and you don't want to have children in future and you are facing fibroid tissue problem, at that time your health advisor can suggest you Mylosis medication. This is the medication which really helps to destroy the muscles and tissues of the fibroids. That helps further to shrink down the size of fibroids. Usually this medicine is preferred once you reached into menopause state, because you are already done with family planning and you don't want to get pregnant anymore. So these are the basic medication which are recommended or suggested by your obstetrician if you have severe symptoms of uterine fibroid. I hope this information will be helpful for you to understand which medication is right for you, and if you really like this content, then take a moment to subscribe my channel. In my upcoming video I am going to talk about what are the non-surgical treatment to shrink the size of fibroid. I'll see you in next video. Till then, bye bye.